Can you believe I had a dream last night about injections?
Oh, man. Are you okay?
Yeah. My parents are in town, so I let them stay in my room, which means I get the...
Their mattress.
Exactly.
Oh, man, it totally, like, deflates by the morning time.
Yes. Which means I end up waking up feeling like I've been through some sort of medieval torture.
When my parents come in, I have to get the pull-out couch, which has that horrible
Bar down the middle.
The worst.
Sounds rough, guys. Okay, today our focus is going to be on administering medications through the parenteral route, which means injection or infusion. Anna, what are some of the differences between medications administered through the parenteral route and those given orally or topically?
Let's see. Parenteral medications are absorbed more quickly, and they begin taking action more quickly than medications given by mouth or through the skin.
Very good. Now, some of the things you should be focusing on today are preparing medications from an ampule or vial and landmarks for intradermal, subcutaneous, or intramuscular injections, okay?
Okay.
Okay.
All right.
Okay, so as the three of you work today, I'll be catching up with you individually to review techniques and discuss procedures. And as you visit your patients, be sure to stop me if you have any questions, okay?
Okay.
Right, sounds good.
Let's get started.
All right.
See you guys.
How long are they staying for?
About a week.
You guys have obviously been doing your homework. All right, are you ready to give your patient her medication?
Yep.
Is the medication in an ampule or a vial?
An ampule.
Okay, good. And just remember, when you're withdrawing medication from an ampule, be careful not to contaminate the needle by touching it to the rim of the ampule, and handle the syringe plunger by the knob. Now, what has the patient's doctor prescribed?
She's receiving vitamin K, 10 milligrams by injection.
Okay, so what will you need to get the medication ready?
I'll need a sterile syringe, a filter needle, an administration needle, the ampule of medication, the MAR, and a small gauze pad, right?
Right.
So to begin, I compare the medication order against the original order, clarify any inconsistencies. I also check the allergies and the expiration date. I'll remember to use the 3 checks and the 5 writes, just like with the other medications.
Good. So why don't you begin, and I'll hang on to this for you.
Okay. My first check is to read the MAR and choose the right medication. My patient's receiving vitamin K, 10 milligrams by subcutaneous injection at 8 a.m. With that, I will take the medication from the drawer. Here it is. And now for my second check, to compare the label to the MAR. Good. Now I tap the stem to move any medication that's in the stem down into the body of the ampule.
You could also hold the ampule vertically and quickly twist your wrist. Now, what's the next step?
Now I will break off the stem by wrapping a small gauze pad or a dry alcohol swab around the neck and giving it a swift snap to break off the top at the scored line in the neck.
Now, when doing this, always remember to break an emotion away from your body.
Right.
Just like you did.
Right. So now I set the ampule on a work surface, attach my filter needle, and withdraw the medication. I prefer to insert the needle into the ampule while sitting upright on the workstation. I could also invert the ampule while withdrawing the medication. So now I have my medication. I remove the needle from the ampule, tap my syringe with the needle facing up, and carefully push on the plunger to expel any air bubbles.
Now, why is it so important to do this only after you've removed the needle from the ampule?
Because injecting air into the solution while the needle's still in the ampule increases pressure in the ampule and can cause the medication to spill out. So now I recap the needle and compare the amount of medication I have in the syringe against the amount needed to deliver the correct dose.
Compare the ampule label and the amount of drug in the syringe with the MAR for your third check, Jeannie.
Done and done. I'm just going to remove the filter needle, attach my administration needle, lock the cart. I'll dispose of the ampule and the filter needle in the sharps container.
I'll get this.
I'm ready to give the drug.
All right, let's go, Jeannie. Nice work.
Thanks.
Okay, I'm ready.
All right, Robert, you're up. So what's on your patient's MAR?
I need to prepare insulin for my patient's morning injection.
Okay, now what supplies will you need to prepare the medication?
Well, I need an insulin syringe, the vial the medication is stored in, the MAR, and alcohol wipes. Now I just need to compare the original order with the MAR just to check for inconsistencies or patient allergies. All right, the order is Humulin insulin, 70/30, 15 units subcutaneous injection, about 30 minutes before breakfast.
Okay, so now you should select the medication from the cart
Okay.
and compare it to the MAR for your second check.
Okay, now I just need to agitate the vial to mix the contents. There we go. And I'll take an alcohol wipe and swab the stopper. And now, just open the package of the syringe and uncap the needle and draw air equal to the medication dose, 15 units.
Good. Now as you do the next step, be careful not to inject air directly into the solution. You want to pierce the center of the stopper, push the measured air into the space above the solution. Then you can invert the vial and withdraw the prescribed amount of medication into the syringe. And just make sure you're only touching the plunger at the knob, okay?
Now what if I see air bubbles in the syringe?
I had an instructor who used to call that an airhead.
I had an instructor who used to call me an airhead.
Sorry to hear that. If you get bubbles in the syringe, just remove the needle from the vial, tap the barrel of the syringe, and push the air out. Once the air is out, you can put the needle back into the vial to withdraw the remainder of the dose. Then remove the needle.
There we go.
Looks good.
15 units. Now just cap the needle and compare the vial label and the amount of insulin in the syringe with the MAR for my third check.
Good.
Okay.
Now, since you're using a multi-dose vial and it's already opened and labeled, you can store the vial when you're finished and proceed with administration.
Okay.
I'll get your trash.
Thank you very much. Okay, let me get the MAR and the original order.
Let's
Ready
go.
when you are.
So, Anna, what medications does your next patient's MAR call for?
The MAR calls for 2 different types of insulin injections.
Okay, now, actually, if a patient requires 2 injections, it's smart to check and see if the drugs are compatible, and if so, you may be able to mix them in one syringe. It's not always recommended, of course, because some don't mix well together. So you should check the compatibility table or a drug administration book to see if they're in the clear. So let's review the MAR and see if the insulins can be administered in the same syringe, okay?
Okay. The MAR calls for Humulin N insulin 15 units and Humulin R insulin 5 units, subcutaneous injection to be given 30 minutes before breakfast.
Okay, let's take a look. All right. Well, according to the drug administration book, both insulins can be safely combined. So let's take a look at how to do that. You'll need an insulin syringe, the insulin vials, the MAR, and an alcohol swab.
So I assume I check the MAR against the original record, check for expiration date, allergies, and then perform the drug calculations.
Exactly right.
Okay. Okay.
I'll hold on to that for you.
All right. Okay, so the MAR calls for Humulin N 15 units and Humulin R insulin 5 units. Subcutaneous injection to be given 30 minutes before breakfast.
After checking the labels against the MAR, you can remove the plastic cap and agitate the Humulin N vial to mix the contents. And swab the rubber stoppers with an alcohol pad.
And next,
Remove the cap from the needle. And inject air into both vials. Start with the vial that's in a suspension.
so that would be the humulin in,
Right.
Okay.
So just draw air into the syringe equal to the dose of insulin.
So 15 units. Okay. 15.
Now inject air into the modified suspension insulin preparation. And remove the needle from the vial.
Okay.
Then we move on to the second insulin, the humulin R, and withdraw air in the amount of the dose into the syringe, in this case 5 units.
5.
And inject the air into the clear insulin preparation. This time, however, do not remove the needle from the vial.
I mean, I can just invert the container and withdraw back the 5 units of humulin R.
Just make sure there aren't any air bubbles and ensure the dose is exactly right.
Okay. 5.
That looks good. Now you can remove the needle from the vial.
Okay. Then I can clean off the stopper of the humulin in and then insert the needle into the vial.
Right. And just be careful not to push any medication from the syringe into the second vial.
I invert the vial and slowly withdraw back the 15 units of humulin in. Now remove the needle and replace the cap.
Exactly. And your third check is to compare the label on the vials and the amount in the syringe with the MAR.
Okay. Okay. I have a total of 20.
Okay. Now you can label the vials and return them to the medication cart and administer to the patient.
Okay.
Grab this for you.
Thanks. Okay, I'm off to do the insulin.
Well, before we go administer your patient's prescribed tuberculin or Manteau test, what can you tell me about intradermal injections, Jeannie?
Intradermal injections are given just below the epidermis, in the dermis of the skin, either on the inner surface of the forearm, the dorsal aspect of the upper arm, or the upper back.
Exactly. And what site should you avoid when giving an intradermal injection?
You should avoid hair, scars, tattoos, any area with inflammation, swelling, wounds, or bruises.
Okay. And what should you remember immediately following administration of an intradermal injection?
You should avoid massaging or putting any pressure on the injection site. And after using the needle, don't recap it.
Exactly. If possible, use a needle with a locking safety cap to guard the needle after the injection is given. Okay? Looks like we're ready. Let's
go. Miss Spot?
That's me. Or you can call me Carla.
Okay, Carla. My name's Jeannie. I'm here to give you the tuberculin test that your doctor prescribed. This is Miss Swenson, my instructor.
Hello.
Hi.
Is it okay if she observes?
Yes. Will the shot hurt?
Well, it'll feel like a little prick.
Okay.
Okay, I just need to check your ID band. Can you tell me your full name?
Carla Spot.
Okay. I'm going to take a look at your forearm. Put it right up there. Now I'll begin by cleaning the inner aspect of the forearm with alcohol using a circular motion, moving outward from the injection site. And allow that to dry.
You hold the syringe in your dominant hand and remove the cap by pulling it straight off. Now be careful not to touch the needle. You want to keep that sterile.
Okay.
Now with your non-dominant hand, spread the skin at the injection site, but be careful not to touch the cleansed area. Now hold the needle at a 10 to 15 degree angle, almost against the skin, bevel side up.
Okay. You're going to feel a prick now. I'm going to insert the needle into the skin about 1/8 of an inch so that I can see the needle through the skin and the dermis barely covers the bevel of the needle.
Then slowly inject the medication and watch for a small wheal or blister to appear. Quickly withdraw the syringe at the same angle it was inserted.
Now I'll slide the needle guard into place, and on my way out, I'll dispose of the needle and the syringe in the sharps container.
That it?
All finished.
That wasn't so bad at all.
Like I said, a little prick.
So Jeannie, as we discussed, be sure not to massage or apply pressure to the injection site, perform hand hygiene, and document the time, date, medication, and medication site.
Okay,
All
I got
right.
it.
One of the nurses will check your arm in 1 to 3 days for any reaction to the test. In the meantime, try not to rub or scratch the test site, okay?
Okay.
Can I get anything else for you, Carla?
No, thank you.
Good job, Jeannie.
Thank you.
Thank you, Carla.
Thank you. Bye.
You have a nice afternoon.
You too.
I think I've got it. And that's that. I have the MAR, the medication, the gauze, alcohol wipes. I'm ready to give an injection.
Very good, Robert.
Oh, but first I have a question.
Of course, what is it?
I just want to make sure that I have the injection sites right for subcutaneous injection. Outer aspect of the upper arm,
Right.
the abdomen from below the costal margins to the iliac crests, the anterior aspects of the thigh, and the upper back.
And also the upper ventral or dorsogluteal areas.
Oh, that's right. I keep forgetting that one, thanks.
Now remember to avoid sites with scars, inflammation, swelling, tattoos, wounds, lumps, bruises, or nodules.
Gotcha.
Now what else can you tell me about subcutaneous injections?
Well, they give the injection in a tissue that lies between the epidermis and the muscle, with a volume limited to 1 milliliter of fluid.
Good. It's important to remember that everyone has different amounts of subcutaneous tissue at different sites on the body. So sometimes you will have to spread or bunch the skin to more accurately deliver the medication.
Okay. Now, with subcutaneous injections, at what angle should I hold the needle?
Anywhere from 45 to 90 degrees, depending on the amount and turgor of the tissue and the length of the needle.
Like so? 45 degrees, 90 degrees.
There you go.
Okay, I think I got it.
Very good. I'll observe while you administer to the patient.
Gotcha. Let's go.
Over and what a success it was. Mansinski.
Mrs. Wierenski,
Hey there. I was wondering where you were. Shot time?
I'm afraid it is.
Oh, goody. My favorite time of day.
Oh, this is my instructor, Miss Swenson.
Hello.
Is it okay she observes?
Sure. He's my favorite student. Give him an A.
Oh, Robert is very good.
Stop it, guys. May I see your ID band, please? Can you tell me your name?
Martha Wierenski.
Great. Now, I have the medication here to help your body make more white blood cells. Is that all right?
That's fine. I'm all ready.
Okay, good. Let me get you ready here. I'm going to put this blanket on top of you.
Okay.
There we go. Okay, put on my gloves.
Okay, Robert. Clean at the site of the injection with an alcohol swab using a circular motion and allow that to dry. And grasp the needle in your dominant hand and spread the patient's skin. Quickly inject the needle to the hub at a 90-degree angle.
You're going to feel a little pinch here now, okay?
Now release the tissue and use your non-dominant hand to steady the syringe, then aspirate. Withdraw the needle and massage the area gently with the dry gauze.
All right, there we go. We're all finished.
All ready?
Yep. Can I get you anything else before I go?
No, thanks. I'm fine.
Great.
Okay, you want to dispose of the needle according to your facility's policy, perform hand hygiene, and document on the MAR, Robert.
Clean this up for you here. Cover you up.
You doing all right?
Yes.
Good.
And let me document on the MAR.
Nice work, Robert. Thank you, Mrs. Wierenski.
You're welcome. Thanks, Robert.
You're welcome.
We really appreciate you doing this. This is Mr. West, who's one of Anna's patients, and he's been nice enough to volunteer to help us today as we review our intramuscular injection sites.
How you doing, Mr. West?
I'm all right, just as long as I don't have to get an actual injection.
Oh, there will be no pain today, I promise. Of course, you know Anna, and this is Jeannie, this is Robert. They're all nursing students here, and they're taking care of patients today. Anna, why don't you start by telling us some points to remember about intramuscular injections?
Okay, intramuscular injections, let's see. It's injected directly into the muscle layer beneath the dermis and the subcutaneous tissue in the ventrogluteal, the vastus lateralis, or the deltoid. Let's see, what else can I say about intramuscular injections? The dose should not exceed 3 to 5 milliliters, and it's 1 milliliter in the deltoid, and it's injected at a 90-degree angle.
Somebody's been studying their book.
Day and night.
Very good. Jeannie, why don't you demonstrate the ventrogluteal site on Mr. West, okay?
Okay, do you mind? I'm going to pull the blankets down. Okay,
Here we go.
thank you. With the patient lying on his side, with his hip and knee flexed, place the palm of your hand on the patient's greater trochanter, with your fingers pointed towards his head. Use your right hand on the patient's left hip to locate the landmarks, or left hand on the right hip. Form a triangle with the index finger and middle finger by putting your index finger on the anterior superior iliac spine. And I'll extend my middle finger dorsally and palpate the crest of the ilium. And my injection site is right there at the center of the triangle.
Okay, very nice. How about the vastus lateralis? Anyone?
I'll take that one.
Okay.
With the patient on the side or in a sitting position, you divide the anterior thigh into thirds, horizontally and vertically, and the injection is given in the outer middle third of the thigh.
Nice work. Robert,
Yep.
how about the deltoid?
Okay. So I'm going to ask you to roll to your right side. And I'll roll up your sleeve. And to find the deltoid site, you will draw an imaginary line 1 to 3 fingers below the edge of the chromium process of the scapula. Think of that as the base of an imaginary triangle, and the point of the triangle is at the midpoint of the axilla. The injection site is at the thickest part of the muscle over the mid-axillary line.
Nice job. Mr. West, thank you so much. We really appreciate your time.
My pleasure.
Great job, guys.
Thanks.
See you later.
Have a good afternoon.
Thanks so much for your help, Audrey. Hi, Miss Winston.
Hi, Anna. Tell me about your patient.
Well, she's been ordered to have a vitamin B12 injection intramuscularly because she's at risk for a deficiency after surgery.
Okay, well, let's go prepare the medication, and we'll go see your patient.
Okay. Hello, Miss Michaels. How are you?
A little sleepy. Other than that, not too bad, Anna.
Okay. It's okay if I give you your vitamin B12?
Sure, why not?
Okay. This is my instructor, Miss Swinson.
Hello.
And she'll be observing me. Can you tell me your name?
Jean Michaels.
Okay, let me just check your ID band. Okay. Just raise you up a little bit here and lower the rail. Okay. So I'm going to raise your gown up just a little bit and uncover what's called the vastus lateralis.
The vast what?
The vastus lateralis.
Kind of sounds like the Northern Lights.
I know it does a little bit, right? Okay.
Anna, would you like to talk through your steps as you proceed?
Sure. I'll cleanse the injection site with the alcohol, allow that to dry, and while I'm doing that, I'll remove the cap from the needle, making sure to keep the needle sterile, and then I displace the skin using the Z-Track technique.
Could you explain the Z-Track technique?
Well, it's the safest and most comfortable method for giving intramuscular injections because it prevents leakage of the medication through the needle track. It reduces pain and discomfort and erratic absorption.
Good. Continue.
Yeah, that Z-Track thing sounds kind of cool.
Okay, let me get my markings here. Okay. Turn you off a little bit. Okay, so with my non-dominant hand, I displace the skin to the side or down about an inch. And I hold it in place. While I'm holding it in place, I take the syringe and I inject it into the tissue quickly at a 90-degree angle and continue to hold it in place with my non-dominant hand.
And aspirate by slowly pulling back on the plunger for at least 5 seconds.
Okay.
If no blood appears, then you inject the medication at a rate of about 10 seconds per milliliter of solution.
Okay.
Well done. Now you can steadily withdraw the needle and let go of the displaced tissue. Careful not to massage, but apply gentle pressure to the site with the dry gauze. Engage the needle guard and properly discard the needle without recapping.
Okay. Is there anything else I can get you?
Any chance I could lunch a little early today? I'm feeling a bit hungry.
I'll see what I can do.
Appreciate it.
Thank you, Miss Michaels.
Thank you.
Let me just get your rail back up here. Do you want your head up a little bit?
That's good, thanks.
How's that?
Perfect, thanks.
All right, so I'll see what I can do about lunch.
Thanks.
We'll talk about that a little bit later today.
Okay.
Just one more thing, Anna. If you choose not to use the Z-Track method with your patient, then the procedure would be to spread the skin taut at the injection site with your non-dominant hand, like this, and proceed with the injection as before.
Okay, good to know.
All right.
I wish I could be outside in the sunny weather today.
All right, guys. Well, it's still fresh in your head. I just want to take a moment to review and discuss what to do with unexpected situations. You're administering an IM medication. You inject the needle and aspirate to make sure you haven't accidentally entered a blood vessel. When you pull on the plunger, there's a flash of pink in the syringe. What should you do, Anna?
Well, remove the syringe, get rid of the needle, the syringe, the medication. Explain the situation to the patient, and then prepare a new medication dose and administer it at another site. Ms. Michaels, one of the things we check for with injections is to make sure we're not in a blood vessel before we give the medicine. Now, unfortunately, I did enter a blood vessel with the needle, so I can't give you the medication.
Okay.
I'm going to go and prepare a new one, and I'll be back in a moment.
I'll be here.
Okay.
Very good. Robert,
Hit me.
you're preparing 2 medications for subcutaneous injection. You've drawn up the first medication, check the amount, and you move on to the second. As you're drawing up the second medication, you mistakenly withdraw 0.9 milliliters of the medication and not the prescribed 0.5 milliliters. What should you do?
You do over. Since the medication has already been mixed inside the syringe, you can't expel the excess medication because you don't have control over which medication you're getting rid of. So you'll have to discard the syringe and start all over again.
Nice job. Are there any other questions or concerns about parenteral medications?
Nope. Nope.
Okay, well in that case, I think we're finished for the day. You guys have a good evening. I'll
Good
see you
night.
tomorrow.
Bye.
Okay, guys, tonight, they're getting the air mattress.
No.
What? Well, why can't we alternate?
Your parents let you live in their house for 18 years. The least you can do is let them sleep on your bed.
Well said.
Thank you.
Well, can't argue with that. So I expect you guys to bring ice packs for me tomorrow morning.
Oh, you're such a trooper.